Okay, I'm going to be demonstrating how to perform an intramuscular injection. So the first thing we want to do is verify we have an order for the injection itself. And once we've verified we have an order, we can go ahead and gather our supplies. So for supplies, we're going to be needing the vial of the medication we're going to be injecting. We're going to be needing a syringe and a needle. Let's say the order said to inject 2 milliliters of medication. So this syringe is a 3 milliliter syringe, so that would work. And the needle we're going to be using is going to be a 22 gauge, 1.5 inch needle. And then we are going to be needing some alcohol wipes and a bandage for after administration. All right, so now that we've gathered all our supplies, we can go ahead and walk back to the patient's room. Okay, in the patient's room, I'm going to hand hygiene, identify myself, identify the patient using 2 methods of identification, such as their name and birth date. Next, I am going to verify that the medication is correct using the 8 rights of medication. Then I would educate the patient as to why they are receiving the medication and what the medication is itself. And once I've completed all of that, I can go ahead and prepare the medication for administration. So I'm going to do some hand hygiene, don gloves, right, and then first thing I'm going to do is pop the lid off of the vial. Pops off. Then I am going to get an alcohol wipe and clean the top of the vial, starting at the center, moving out for a few seconds. All right, and set that there to dry. So we would also need a blunt tip or filter needle to draw the medication. We don't actually have that, so I'm just gonna pretend with the needle I'm going to administer the medication. So we would first attach our syringe to the filter or blunt tip needle, and we're going to use that needle to draw up the medication. So we are going to uncap our needle, and then we can draw up 2 milliliters of air because that's the same volume of medication we need. And we're going to instill that into the the vial. Right, instill the air. And then we're going to invert the vial. And we can get our medication. Right. That is 2 milliliters of medication. We're going to remove our needle. We would recap and then unscrew the blunt tip filter needle. Discard that one. Screw back on the needle we're going to use to administer the medication. And then the medication's ready to be administered. So now I would just grab another alcohol wipe and wipe down the site of injection. So I'm going to be injecting my patient's left deltoid today. So I'm going to start at the center and move outwards. Let that dry. Air dry, don't blow on it. All right, so I am going to hold this by kind of like pulling the skin away. And then with my dominant hand, I'm going to do the injection itself. To remove the cap, pull away the skin. Okay, like a dart, inject. And then stabilize the needle, aspirate. If you have no blood return, you can go ahead and inject. Slowly. All right, and then just remove the needle. And then you can use the table to engage the safety. And you don't want to massage the site of injection. You can apply like a little bit of pressure with gauze, and then you can provide them with a bandage if there is any bleeding. And then you discard this immediately into the sharps container. And after that, you can just get rid of any extra supplies that you had left, document the administration of the medication, and just monitor the patient for their response to the medication. And of course, perform hand hygiene at the end.